Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. As always, it's an honor and a pleasure to be spending this time with you. If you're using any type of psychologically informed care, whether you're a physical therapist, an occupational therapist, a coach, a nurse, a physician, or a mental health provider, you'll notice that many people observe that pain impacts their thoughts and brings about emotional states that affect their body, aggravates pain, and for some, increases their desire for drugs such as opioids. More and more patients are seeking integrative and comprehensive pain therapies that care for both their body as well as their mind. Some realize that pain medications alone are not enough to address the root cause of their problem. On today's episode, we speak with Professor Eric Garland, who teaches at the University of Utah, is a licensed clinical social worker, and a researcher who uses mindfulness to treat many chronic conditions. His research has been shown to be effective and support the recovery from alcohol dependence, opioid misuse, nicotine addiction, relieves pain, as well as symptoms of post-traumatic stress disorder, reduces video game addiction, and unhealthy eating behaviors. Today, we'll take a deep dive into the theory, research, and practical components of delivering mindfulness-based interventions. Specifically, this episode centers around three concepts that I want to define before we begin today's episode. The first is simply mindfulness, which is a state achieved by focusing one's awareness on the present moment while accepting thoughts, feelings, and bodily sensations. The second is reappraisal, which entails helping people shift their thinking and developing new, more helpful perspectives, beliefs, and actions to deal with stressful events. And the third is the skill of savoring, which is a positive sense of reward needed to drive and sustain behavior change. This is an excellent episode for those living with chronic pain, stress, and related conditions, as well as the practitioners who treat them. I really enjoyed speaking with Eric today, and I know you will as well. Okay, let's begin and let's meet Professor Eric Garland. Hey, Eric, welcome to the Healing Pain Podcast. It's great to have you here this week.
Thanks for having me here, Joe.
I'm excited to talk about some of your work, both your clinical work and your research, which I know are intimately related, and of course, discussing some of the mechanisms around mindfulness. We've discussed a lot of different types of psychological interventions on the podcast over the years. We haven't gone deep into mindfulness, and some of the research you have really starts to go deep into the mechanisms and the moderators, which is really interesting. But before we get into all that technical stuff, tell us how you first became interested in mindfulness.
Sure. My interest in mindfulness really began with a deep, abiding, personal practice of mindfulness meditation. And I started that when I was 18 years old, as a way just to help me navigate life and gain deep insights into what life was all about. And I kind of married that personal interest in mindfulness practice with a scholarly interest in the philosophies that wrapped around mindfulness meditation as the centerpiece. So I was studying various branches of Buddhism and Hinduism and Taoism in college. And there was a time when I thought I would become a scholar of contemplative religious studies. Mm-hmm. But actually I went a different path in life and became a clinician instead. So I took this personal interest in mindfulness. That was really a path to personal spiritual growth. And I developed it into a tool to help people who are suffering from chronic pain and addiction and mental health problems. And then after doing clinical work in the field for a while, mostly in integrative medicine settings, then I began my career as a scientist, where I really focused on mindfulness in earnest to understand its mechanisms and really show with rigorous science how it could help people.
So interesting. I mean, at 18 is relatively young to start mindfulness and just kind of fall into it. I'm sure lots of people would like to see their kids practice more mindfulness and meditation. I know it's used in lots of schools and different types of programs. And then, of course, you became a licensed clinical social worker. Did you start implementing mindfulness in right away? Because sometimes clinicians can have a hard time kind of weaving mindfulness in with patients, or they're not sure how to explain mindfulness or how to explain what they're doing in practice? How did that start to evolve for you before you got to the research part?
Yeah, it's funny you asked that question, because I got into this integration of mindfulness into psychotherapy before it was really a thing. Before the world had really heard a lot about Jon Kabat-Zinn and mindfulness-based stress reduction. This was in the early years when there were certainly psychotherapists practicing mindfulness, but it was more in the underground. And actually, the thing that I could find that was closest to the mindfulness traditions that I had been studying from a philosophical standpoint, the technique that was closest in the Western medical arena was actually clinical hypnosis. Mm-hmm. And so I started early in my career with getting certified in clinical hypnosis. But really, I was doing that to find a sort of Western legitimacy to this meditative pursuit of altered states of consciousness. So as time went on, actually, it came to be that because of all the good science around mindfulness conducted by my colleagues, and I hope I myself have contributed to that, that mindfulness became something that was more accepted in Western medicine, and we started to be able to talk about it. But so, yeah, from the early days of my clinical practice, I was weaving in mindfulness meditation into sessions with patients, along with hypnosis and cognitive behavioral therapy. And it was a potent combination.
How would you differentiate mindfulness from, let's say, traditional cognitive behavioral therapy?
That's a good question. I mean, I think the first starting point of bifurcation is that in traditional cognitive behavioral therapy, we aim to actually change negative thoughts, to actually transform negative thoughts into more helpful ways of thinking about life stressors. Whereas in traditional mindfulness meditation practice, we aim to actually disengage from thought entirely and shift into a different mode of experience where we're witnessing thoughts and emotions without trying to really actively alter their content. I actually, although I just gave you that explanation, I actually think that's sort of an oversimplification. And in fact, I advanced a theory, that was more than a decade ago, where I proposed that mindfulness would actually facilitate the transformation of thoughts, so that mindfulness should actually enhance the ability to do cognitive therapy, because mindfulness helps us to have a more psychologically flexible perspective on our life situation. And actually, there's been a fair amount of data gathered to support that hypothesis over the past 10 years. So I don't think the distinction is that clear cut as one might think, but certainly the main difference is mindfulness teaches us a different way of being in the world, as opposed to cognitive therapy, which it focuses more on changing our behaviors.
Interesting. So when you mentioned that mindfulness, I guess, could help, let's say, facilitate traditional CBT, which is changing thoughts, which that shows up in a lot of different types of psychotherapies. Even something that's called pain education has aspects of that.
Right.
With that, I know that I kind of know the answer to this, but I'm going to kind of ask you that anyway. Would the mindfulness come before you try to, let's say, reappraise or help restructure thoughts? Would it come after, exactly, or is it present throughout, in some way, throughout the entire? It's like a through line, in essence, throughout the entire aspect of it.
Well, great question. And I early on, as a trained cognitive behavioral therapist, but also someone who was really immersed in the mindfulness field, early on, I wanted to integrate these two things into one approach to practice. And that was one of the major impetuses for me developing mindfulness-oriented recovery enhancement, or MORE, which integrates mindfulness training with cognitive behavioral therapy and also principles from positive psychology, and namely the most important one being savoring. So that really, that notion spurred me on to do this. But to answer your question directly, in MORE, we teach mindfulness as a foundation upon which we scaffold these other skills. So first, we teach mindfulness as the platform and the foundation, in order to help patients to develop greater stability of mind, better attentional control, better clarity, and also an openness and this psychological flexibility that then they can use to reappraise negative thoughts about their lives and to shift into focusing on positive life experience and really savoring the good out of it.
It's something for us to all think about. I've always thought, okay, so if we're in a controlled environment in the clinic and I'm prompting someone by asking them what type of thoughts or emotions you're having around the problem you have, we're prompting them to notice or observe their thoughts. But when they're out on their own, if they don't have the skill of observing, then they may not be able to engage themselves in that process of restructuring or reappraisal. Would that sound correct?
Definitely. Right. They might just find themselves freaking out and not even knowing why. Quote, "I'm in a bad mood today." Why are you in a bad mood? I don't know. It's a crappy day. Mm-hmm. But not necessarily having the insight to catch the moment by moment arising of the negative thought patterns that then promote those destructive emotions.
Interesting. You have a paper, which I recommend everyone should read. It's in Current Opinions of Psychology, 2019. It's called Positive Psychological States in the Arc from Mindfulness to Self-Transcendence, Extensions of the Mindfulness to Meaning Theory, and Applications to Addiction and Chronic Pain Treatment. It's a long paper with some really interesting theories, and one you mentioned, savoring. So I just want to touch on that first. What does savoring mean to you? And how does that impact on states of chronic pain?
Yeah, so that paper that you referenced is probably one of the most wild pieces I've published so far. So I commend you for reading it because I really went out on a limb in some of the theories that I pushed in that paper. So and in that paper, savoring is a key piece of it, but there's almost a journey, if you will, that begins with mundane forms of savoring, leading all the way to self-transcendent forms of savoring. So to put it mundanely, put it simply, savoring is the process of focusing attention on pleasant everyday events and not only appreciating the pleasure that can be derived from the sensory features of that event. So how it looks, how it smells, how it sounds, its touch, texture, etc. But also becoming aware of how encountering this pleasant experience is affecting you. So how is it affecting your emotions? How is it affecting the bodily states of pleasure that can arise when you're having a good experience? And actually that second part of savoring, I think is crucially important. And it involves this process of mindfulness, because when we're really savoring something, let's say, a beautiful sunset or nice weather, breeze on a warm summer day, you can appreciate the experience, but at a certain point it starts to really affect you, and you start to notice those positive emotions of contentment, relaxation, or maybe joy or appreciation. And then those emotions also have this impact on the body, right? We start to notice pleasurable sensations in the body. And as this occurs on a neurophysiological level, there's activation in reward circuitry in the brain that is in part mediated by the endogenous opioid system. And that happens to be involved in the body's own natural pain-killing process. So you asked, what's the connection to chronic pain treatment? I think part of the connection is there, that when we're deeply and mindfully immersed in a pleasant everyday experience, that experience becomes so rewarding that it actually can relieve pain. And the neural circuitry of pain and pleasure are intimately intertwined.
So you give a nice example, like, your first day on the beach after a long, cold winter, and just the feeling of, sunshine on your skin and that warmth. And that's pretty easy for us to connect to a savoring type experience.
Right. But actually, from a physical therapy standpoint, I'll give a different example. So let's say you're doing you're doing a stretch or some sort of physical therapy exercise with a skilled therapist, and you get right to that point where it's pushing you, but it's not pushing you too far. And in that moment of your body getting activated again, there may be some pleasure in that moment. And now if you have a bunch of beliefs that have accrued around that, like I hate exercise, or I can't do this, or this is going to hurt me, you may not notice that. And therefore you may need techniques like mindfulness and reappraisal to overcome those negative kind of thought patterns. But when you then focus in on the experience and you feel, the warmth in your muscles, and you recognize that this activity is actually good for you and it's helping to heal you, there can be a source of pleasure there.
I love that for physical therapists. And then when I started to look at some studies on, like, say, traditional exercise versus more mindful movement practices like yoga or Tai Chi, which purposely have an awareness component to it or a focus component to it, that it offers an opportunity that we can teach people to actually savor, let's say, movement when beforehand they were adverse to it in some way.
Exactly.
That's a beautiful thing. That's a really beautiful thing. And then also in this paper, you also talk about a transcendent upward spiral, which I think is really important to maybe just talk about what an upward spiral means in that. And then you talk about aspects of decentering, attentional broadening, reappraisal, and then savoring was the first part of that. But it starts to sound a little bit like these are mechanisms of how mindfulness is, in essence, working. Is that what you're kind of saying in this paper?
Yes, definitely. And that all these various mechanisms that you named, they interact with one another to create what I and my colleague and mentor Barbara Fredrickson have termed an upward spiral. So we observed in research, more than about a decade ago, that essentially that positive thoughts and emotions can magnify each other. There's a lot of downward spirals in life, a lot of vicious circles we get into. Negative thinking makes us feel bad. When we feel bad, we don't feel like being active or doing things that are good for us. And then that makes us feel worse. We start to think negatively about ourselves. And then that gets us trapped further in this downward spiral. Mm-hmm. And so in the same way that there are downward spirals in life, there can also be upward spirals in life. And that we can actually interrupt and actually reverse this downward spiral process by inducing an upward spiral of positive cognition and positive affect. And mindfulness, we posited, again, 10 years ago, that mindfulness would be a linchpin in reversing the downward spiral into an upward spiral. But mindfulness is not the only process that's important here. It's a key process because, again, as you pointed out, it helps us to become aware of when we're falling into the negative mental pattern, and then gives us some freedom from it. But mindfulness then can actually, the theory goes, can synergize more elaborate cognitive and emotional processes like reappraisal and savoring. Mm-hmm. And so when we're mindful, we have the capacity to reframe the difficult parts of our life as meaningful, as teaching us something important, as helping us to grow. And when we do that, we feel better, we feel happier. And when we really savor those positive feelings, that further accelerates the upward spiral, because then when we're in a positive mental state, and this is really Barb's work, that tunes our attention to notice other pleasant and good parts of our lives. And it broadens the field of cognition. It makes us more open-minded and start to notice parts of our life that we didn't notice, and helps us to come up with creative solutions to our life problems, and really motivates us to take meaningful action to improve our lives. So that whole arc that I described, that I call that the mindfulness to meaning theory. And that was, the mindfulness to meaning theory is really the basis for this paper that you're referencing. The new piece that the paper adds is the self-transcendent aspect. Mm-hmm. And so as the upward spiral goes, and we start to have these more meaningful experiences of getting really engaged in life, connected with other people, doing things that we care about, we may also progress to experiences of self-transcendence, where you actually get beyond yourself and start to connect with something greater than yourself. And that's really, it's really a healing experience, and it can be very liberating. And from an analgesia standpoint, my colleagues and I like to joke, no self, no pain. And if you think about it, if you don't if you don't have a self, you're not going to be in pain, right? And so in those moments when you actually transcend yourself, you get beyond your limited perspective and beyond your kind of fixation on the condition of your own individual body, then that can be relieving. And this maybe starts to sound like a bunch of metaphysical gobbledygook, but I've got data to back this up. So we published data from a randomized controlled trial last year in the Journal of Consulting and Clinical Psychology that showed that the mindfulness therapy that I developed, mindfulness-oriented recovery enhancement, which integrates training in mindfulness, reappraisal, and savoring, significantly decreased chronic pain severity and significantly decreased opioid misuse. But germane to what we're just talking about right here, what we found that was really interesting was that this therapy was reducing pain in part by increasing self-transcendent experiences. And that actually self-transcendent experiences statistically mediated the effect of mindfulness-oriented recovery enhancement on relieving pain. So these kind of lofty metaphysical experiences actually have real clinical value. And when we discovered that was really exciting to us. We were pretty thrilled because I think this is probably the first time this has been shown in the scientific literature.
It's interesting because if you talk to people who are longtime meditators, who have gone on long meditation retreats, they'll mention this sense of a transcendent sense of self, so to speak. And as you probably well know, it's hard to describe, and sometimes it's actually really not hard to describe because it's so clear when you're kind of in the moment. And anyone who has had the experience, it's kind of easy to talk to them about it. But if you haven't had the experience, people have a hard time identifying with it. How do you put in words developing that transcendent sense of self that comes from a consistent or a deep mindfulness practice?
Well, you're right. It's hard to put it into words. But since we're talking about savoring, I'm gonna bring it up in the context of savoring. So, and recognizing this connection, actually, I only connected these dots recently, which is one reason why I wrote this paper that you're referencing. So in that moment when for example, you've been stuck inside due to COVID and you've been really missing the ocean, and you finally get out to the ocean after a long time, and you stand at the edge of the water and you're hearing the sound of the waves and you're feeling the warmth of the sun. When you're in that moment savoring that experience, you can, under the right conditions, experience a sense of oneness with the world around you. And so what is that like? I mean, that could be like the quieting of your mind so that your thoughts slow or even completely cease. There's no more focus on your body as this sort of isolated unit, but rather you may feel this sense of there's almost like a physical continuum between yourself and the world. There's no sharp boundary between yourself and the world. So actually the kind of envelope of the skin in which we all find ourselves, that boundary starts to become more permeable, starts to dissolve and even fade away. And sometimes in that experience, there can be a feeling of blissful warmth that kind of extends outward into space, or other people describe it as a form of love or communion or connection, or peace. But really a sense of there being no separation between you, the observer, and the world that you're observing. It's all one picture. How's that?
Sounds good to me. Is there a sense, is there a sense of stepping outside yourself and being able to observe yourself, observing the experience?
Okay, so that gets back to your first question about the mindful sort of form of self-transcendence. So what I was just describing to you is more of this relational form of self-transcendence. And actually, my colleagues and I developed a quantitative instrument to assess self-reports of self-transcendence called the Nondual Awareness Dimensional Assessment. And we published that a couple of years ago in the Journal of Psychological Assessment. And so there we found really two domains of this self-transcendent experience. One was more relational, like I'm describing, and the other is one that you're kind of hinting at, which is where you are observing, you stepped back and you're observing yourself and observing your experience. And then there's a certain moment at which the observing capacity turns back upon itself. Mm-hmm. So you're no longer focusing your awareness on the objects of your experience. So you're no longer focusing on your thoughts, your feelings, or your perceptions, but awareness is focusing on itself. It's focusing on its own capacity to be aware. And that can get kind of like the feeling of, you ever stand between two mirrors and you're looking at yourself in one mirror and you're seeing the reflection, mm-hmm. and it kind of goes back to infinity. Well, there's kind of a sense of that in that moment. And that's sort of a different attitude of self-transcendence than the relational one. But they're both really, they're both things that as you say, advanced meditators and practitioners have discussed for thousands of years. And we're only beginning to really understand these states and their clinical value with modern science.
Yeah. I know you've done some, obviously, work in this area, some research. Any idea how many hours it takes someone to be able to dip into that sense of transcendent self via training?
Well, I can give you clinical anecdote from the trials that I've conducted. And I've over the past 10 years, I've probably enrolled more than 1,000 patients in randomized controlled trials of mindfulness-oriented recovery enhancement. And what I can tell you is that in the very first session, there are some patients who drop into that immediately, which is pretty shocking, actually. Because if you ask people, when does this happen? People say, oh, only to the most advanced meditators. But that's actually not what we found. And when we do this research with people who are in a bad way, a lot of the people in our studies have multiple medical and psychiatric comorbidities. They're suffering from chronic pain. They're suffering from major depressive disorder. They're suffering from PTSD. They might be addicted to opioids or other drugs. They don't necessarily have a high level of education or high SES. Many of them are unemployed. And of this group of people who've really, been through some tough stuff in life, I would say out of a group of 10 people, there'll be one or two people who tap into that state almost immediately. There'll be other people in that group who it takes them 5 to 8 weeks of training, of practice to taste that state. And then there are others who, maybe they never achieve it in the 8-week intervention that we have been studying. But we've been surprised at how patients will tiptoe into this state. I'm not saying, they're not swimming in it. They're not totally immersed, but at least touching it. Fairly, it's not too uncommon, let's put it that way. And really the key is actually asking people about it. Asking them about whether they've experienced it and actually and if they do start to experience a taste of it, giving them some positive reinforcement for being open to an experience like that.
Yeah, it's interesting because I was a meditator. So I've studied ACT pretty extensively. And in ACT, they talk about this transcendent sense of self.
Yeah.
And I meditated for years. I never experienced it. And one day, you just, like you said, you just dip into this and it's like, whoa, this different room, like you kind of walk into. And at the end of the meditation, I went up to the instructor. This is at a very traditional contemplative Buddhist type meditation center. And I said, I had this experience. And she said, well, if it comes up, that's fine. Just allow it to be there. She said, but we don't really encourage people to detach from the experience. And I had read enough research at this point. I was like, no, I was fully present. I wasn't detached. I completely knew where I was, what was happening. I knew the context I was in, the room, et cetera, et cetera. So, and I, at that point, I think my scientific jargon and her explanation weren't able to kind of connect at that point. But it's not detaching from yourself, though, at all.
No, it's not. But that kind of response is precisely what I'm alluding to when I say, if you actually encourage people to talk about it and give them some reinforcement, you may be surprised at how readily people experience this. It's funny because talking about this stuff has been considered a no-no,
right,
in many spiritual traditions, and therefore in the modern mindfulness-based therapies that have emerged from them. And quite frankly, I think that's a pity, because there's a lot of therapeutic potential in those states. Now, I think if you look at the traditional Buddhist philosophy, for example, around this issue, those types of tastes of experiences, people are worried that somehow people are going to become attached to them and they're going to become an impediment to enlightenment. But I'm not in the business of enlightenment. I'm a psychotherapist. My job is to help people feel better. So I have no, the traditions could be right. The attachment to these states could be an impediment to enlightenment. But, as a social worker, I may only have 6 to 8, 10 sessions to help somebody who's suffering from a wide range of issues. And if I can help them to achieve a healing state of consciousness that helps to significantly alleviate their pain and their craving for drugs, or let's say, need to take opioids, then that's a win as far as I'm concerned.
Yeah, because I really think what you're saying is that this particular aspect is probably not trained enough in either traditional mindfulness or when mindfulness is used in a clinical setting.
Right. Exactly. And yet these tastes of these states can be therapeutic.
Yeah. Yeah.
And actually, I just finished the biggest and most important study of my career. So this was a 5-year clinical trial funded by the National Institute on Drug Abuse, and this was a study of mindfulness-oriented recovery enhancement for opioid misuse in chronic pain patients. And the study had 250 patients in it, so it was a big clinical trial. And we found the same pattern, that people did achieve these transcendent states, and that the effect of mindfulness-oriented recovery enhancement on reducing pain was statistically mediated by this self-transcendent experience. So we've got 2 separate randomized controlled trials replicating this effect. So to me, that means these states are important. If they're actually associated with clinical benefit, then we need to pay attention to them as healthcare providers and scientists.
Can you tell us a little bit about your MORE protocol?
Sure. So MORE is a manualized treatment. So the treatment is actually published as a book. And it really is an integration of the 3 great traditions of mindfulness, cognitive behavioral therapy, and positive psychology. And so it begins with a platform of mindfulness. So we teach mindfulness in the beginning of the treatment, and we teach mindfulness meditation at the beginning of every therapy session. And MORE is actually an 8-session protocol. But then as the treatment sequence goes on, we start introducing other techniques. So next we introduce reappraisal, helping people to challenge and change negative thoughts, to help them to find meaning in the face of adversity. And then we introduce the skill of savoring. So teaching people how to mindfully focus their attention on what is pleasant, meaningful, and good as a way to extract a healthier sense of pleasure and joy. And also to remediate deficits in the brain reward systems that we know are integral to chronic pain, addiction, and mood disorders. So that's sort of this treatment sequence: mindfulness, then reappraisal, then savoring. But as you say, mindfulness is woven throughout as the thread that connects, and that continues for all 8 sessions of the therapy. So we're really trying to teach patients how to not only alleviate physical pain and emotional pain, but also to gain self-control over craving and over their automatic behavior.
Because the craving is important with regard to the opioid addiction.
Right, exactly.
Yeah.
So I've studied more for 10 years, actually 12 years now, as a treatment for a variety of addictive behaviors. So alcohol use disorders, substance use disorders, smoking cessation. We've studied it as a treatment for obesity, video game addiction. But the most of the work, the bulk of the work, has been on people with chronic pain who are taking prescription opioids and who may be at risk for progressing to misuse opioids or have already gone all the way to opioid use disorder. And so there's a lot of data at this point on more, and the data across all of these trials, if you look at it as a whole, it really shows this is an effective therapy. And not only do we have clinical outcome data, but we also have a whole bunch of neuroscience data to show how more is changing the brain and the body. And there's a lot of interesting effects there. But one of the interesting ones is that it really seems to be restructuring the way the reward system in the brain works. So by helping people to become less reactive or less sensitive to drug-related cues, and to become more sensitive, more responsive to natural, healthy rewards. So not only do we teach people savoring and they tell us, after you taught me that technique, now I really can enjoy life more, but their brains actually become more responsive to natural pleasure. And we can measure it with EEG.
Yeah, so you can see neuroplasticity happening from the intervention.
Exactly.
How many minutes do you require the participants to work on mindfulness or meditation throughout the protocol?
So in the sessions themselves, the 8 sessions, we gradually titrate the length of the mindfulness meditation. So in the first session, it's about 7-ish minutes long. And by the 8th session, patients are sitting for about a 40-minute long mindfulness meditation exercise. For homework, we only prescribe 15 minutes a day. And you know what, that's a lot less than some of the other mindfulness therapies that are out there, but it's hard for people to sit and practice for a long period of time. And we're finding, even if we just prescribe 15 minutes a day, that seems to be enough to produce these benefits.
Yeah, I'd agree with that. I mean, there's some pretty good research around smaller, brief interventions with regard to mindfulness and, supporting some type of change. So, and it's also doable for people. Exactly. Yeah, it's approachable and it's doable for them.
Yeah, we tell people, even if you can't do 15 minutes, do 3 minutes. Do 3 minutes 5 times a day. Whatever it takes. Just try to practice some. And our data is showing that duration of mindfulness practice is correlated with the clinical outcomes. So the people who practice longer, they are getting more benefit. But there may be patients who never practice outside of the session. And that's why teaching mindfulness in the moment in these sessions is so important. Actually giving people the therapeutic experience with mindfulness during the session, that may be their opportunity to really have this healing experience.
I like some of the processes that you talk about in the paper with regard to mindfulness, because it starts to make you think about what psychological process is at work when you're teaching mindfulness or mindfulness is taking root in someone. There are some people who have a critique on mindfulness, who claim that it lacks the behavior change part of it. So the cognitive part is there, but yet the behavior change part is not there. Do you have a response to that, or some words you would add to that conversation?
Yeah, I mean, that's a legitimate concern. I see that point, which is why I think there's a lot of gain to be had by integrating mindfulness with other forms of therapy, like cognitive behavioral therapy.
Yeah.
So I agree. I mean, you can change the mind, but where the rubber hits the road is how people change their life and actually get engaged with life. And I've in my private practice, I've done psychotherapy, for a while with lots of different conditions. And I remember a case I'll never leave my mind. I've treated major depressive disorder with purely behavioral techniques. I didn't do anything cognitive at all, and it worked wonders. So I see their point, this critique to mindfulness, but I do think that it's not an either or kind of, it doesn't have to be an either or approach.
Mm-hmm.
At least that was my standpoint, and that's why I developed mindfulness-oriented recovery enhancement, because I think that mindfulness would facilitate the positive behavior change that patients need.
Yeah. Excellent, Eric. It's been a pleasure talking to you, and I enjoy reading your research. I think it's definitely needed with regard to how mindfulness impacts all the different types of processes and, of course, different types of both mental and physical health conditions. Can you tell people how they can learn more about you and how they can follow your work?
Yeah, thanks, Joe. I have a website, so people could come check out the work there. That's www.drericgarland.com. And I also provide training in mindfulness-oriented recovery enhancement to clinicians. So I train social workers, psychologists, nurses, physicians, physical therapists. I train healthcare providers in this technique. I hold a couple of trainings every year. These are 2-day workshops, really intensive, kind of combine didactic with experiential learning and mock client therapist interactions. And since COVID, I've been holding these online, so doing it over Zoom. And that seems to be really good format for people to learn no matter where they are. So actually the next one of these is coming up September 25th and September 26th. And so if you're interested, come to my website.
Excellent. So I want to thank Eric for being on the Healing Pain podcast this week. Make sure you check out his work with regard to the MORE method. It's you can find it at drericgarland.com. Of course, all the links are on the show notes on the podcast page. Once again, I want to thank Eric for joining us this week on the Healing Pain podcast. Stay tuned, and we'll see you next week.
Thanks, Joe.
Thank you for listening to the Healing Pain podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.